Hi, everyone. This is Amy. My clock says, my clock says 11:59. I'm in Central Time Zone. So it's actually, now it says 12, so it's 1 o'clock Eastern Time, and we are going to go ahead and get started. It looks like we have several participants on. Thank you for joining us today. And as part of the 2021 eHealth Summit, I'm here to present on some HIPAA updates. And we are so excited to be partnering with KHI this year to present to you a presentation we put together for building your HIPAA security toolbox. And we're going to cover the 2021 HIPAA regulatory updates as well. First, I must share our general UK disclaimer that the information contained in our presentation is for general information purposes only. And this is our HIPAA privacy and security team at the Kentucky Regional Extension Center. Brent McCune is our managing director. I am a HIPAA security advisor. I've been working with the REC for almost 7 years now, and I work on the HIPAA privacy and security service line, as well as the promoting interoperability service line. And Seth is our senior HIPAA security advisor on our HIPAA team. And Seth is with me on the presentation today as well. Okay, so let's jump in. So the objective of our presentation today, we're going to start with the regulatory updates that have been released, the new proposed rule for HIPAA privacy. So we'll just briefly cover that. And then we're going to, just to start the presentation off, talk about the difference between HIPAA privacy and security, just kind of set those parameters. Then the bulk of the presentation is going to be looking at what are our biggest threats to the security of our electronic protected health information. And once we learn what those threats are, then we can begin to build a toolbox of some resources, and most of them are fairly new that you may not be aware of. And so those online resources will become what we kind of call our HIPAA security toolbox. So before we do kind of go on, I like to provide just a general history of HIPAA and where we started and where we've come with HIPAA over the years. HIPAA, of course, as you know, stands for Health Insurance Portability and Accountability Act. And in 1996, President Clinton signed in to effect the first HIPAA rules. And this act was created to improve the portability and accountability of health insurance coverage for employees and for patients. Other objectives of the act were to combat waste, fraud, and abuse in health insurance and healthcare delivery. So that kind of set the precedents, starting us off with HIPAA. Then our next introduction with HIPAA laws came in 2003. So the effective date of the HIPAA privacy rule was April 2003, and the privacy defined what PHI, or protected health information, is. And that definition is any information held by a covered entity which concerns health status, the provision of health care, or payment for health care that can be linked to an individual. And so then the next rule that came about was the HIPAA security rule. The HIPAA security rule specifically dealt with ePHI, so electronic protected health information, and it laid down the security safeguards by which we should use to protect all of our PHI. The next rule that came out in 2006 was the HIPAA breach enforcement rule. So this was necessary because of the failure of many covered entities to fully comply with HIPAA privacy and HIPAA security. So that's why the enforcement rule was introduced. And basically it gave the power of the Department of Health and Human Services, which is HHS, to investigate complaints against covered entities for failing to comply with privacy rule, and to fine those covered entities for avoidable breaches of EPHI due to not following the safeguards that were laid down by the security rule. So then in 2009 came the high-tech rule, and high-tech, the primary goal was to compel healthcare authorities to implement the use of EHRs, and it introduced the Meaningful Use Incentive Program. And then the final rule that we've seen prior to the one that has been introduced this year, the new proposed rule for modifying the privacy rule, the last one we've seen in effect was the final omnibus rule. And so omnibus rule set out to achieve and make covered entities aware of HIPAA safeguards that they had to adhere to. So again, we were still seeing breaches that were pointing to the fact that we really weren't following our responsibilities under the HIPAA security rules specifically. So the omnibus rule provided further definition around safeguards. It provided further guidance for business associates and the subcontractors of business associates. And it's basically, we saw the most changes with the omnibus rule to HIPAA security that we had seen since the HIPAA security rule had come out. So that's kind of where we are with HIPAA, just a little brief history and overview. So with the final rule that was proposed back in January, so January 21st, 2021, a proposed rule came out called Proposed Modifications to the HIPAA Privacy Rule to support and remove barriers to coordinated care and individual engagement. So you may or may not be aware that the rule was released, and generally what happens is a rule will be released. It's a proposed rule. The Department of HHS will solicit comments and feedback before they actually finalize the rule. Once the rule is finalized, which could happen later this year, you'll have 60 days before the rule will go into effect. So that's usually how this will happen. And so let's look at, and there is a link on this slide to the entire rule, which is many, many pages. But if you are a HIPAA privacy officer for your organization, I would encourage you to go read the rule in its entirety. But just as a kind of a summary for what this rule is going to do and what the goals of the proposed changes are. So the main goals is to better support individuals' engagement in their care, remove barriers to coordinated care, and reduce regulatory burdens on the healthcare industry. You may have seen over the past year several, I guess, reports, breach reports or notices that have come out. I think they've finalized 19 breaches that had to do, well, not breaches, but complaints that were filed due to rights to access, patients' rights to access. And HHS has been working diligently on these complaints. And so I really think that a lot of this final rule has been driven by all of these rights to access complaints that have been filed. So what really would the proposed rule do once it takes effect? And there is a lot to this. So it's hard to kind of summarize this in one slide, but I do want to share with you that there would, the MPP, the Notice of Privacy Practices. So the rule is proposing that we eliminate the requirement to obtain written patient acknowledgement of the MPP. However, even though the patients wouldn't have to necessarily sign that they've received that MPP, it would modify, the rule is proposing to modify the content requirements of the Notice of Privacy Practices to clarify an individual's rights with respect to their PHI and how to exercise those rights. The rule would also revise the minimum necessary standard, and we throw that term minimum necessary around a lot in our world, but it would revise that standard by basically allowing for disclosures related to care coordination and case management by relieving covered entities of that minimum necessary requirement. So basically, it relieves the requirement for uses, disclosures, or requests by or to a health plan or covered healthcare provider for care coordination and case management activities with respect to an individual, regardless of whether such activities can constitute treatment or healthcare operations. There's a lot more information in the final rule, the proposed final rule, about how that takes place and guidance around that. But just as a summary, just know that that's what they're looking to do, is to revise that standard. It also would broaden allowable disclosures for health emergencies. So it would expand the ability of covered entities to disclose PHI in person, which includes allowing individuals, or I'm sorry, let me back up here. Broaden allowable disclosures for health emergencies, which currently what we look at for those is to a serious and imminent threat to the health or safety of the patient. So it's proposing to expand the ability of covered entities to disclose PHI to avert a threat to health or safety when a harm is serious and reasonably foreseeable. So rather than serious and imminent. So it's kind of a change on language there. So if it's serious and reasonably foreseeable, then we are expanding, or the rule would expand the covered entities' ability to disclose PHI in those events. Then to expand an individual's right to access their PHI. And again, I think this comes a lot from these notices that we're seeing and the complaints that have been settled about surrounding rights to access their PHI. So just a little bit of information on that. This proposed rule would strengthen an individual's rights to inspect their PHI in person. So put your seatbelt on for this. That includes allowing individuals to take notes or use other personal resources to view and capture images of their PHI. So yes, they could actually take pictures of their records while they're in the exam room with you. And there were a lot of comments in opposition to this from providers. So it's going to be interesting to see how this plays out and how it actually comes about in the final rule, whether they modify that further, whether they keep it, or whether they do away with it based on all of the feedback that they did get. It also would shorten the covered entity's required response time to no later than 15 calendar days to respond to a patient's request for their PHI. And that's in contrast to the current 30 days. And again, there were several comments surrounding that. The comments were so interesting to read. And I tend to side with the providers on this due to the fact that a lot of times to get those records, you have to rely on third-party resources and you have no control over how long it takes them. So what it's saying is you would have no more than 15 days to respond to the request, with an opportunity for an extension of no more than an additional 15 days. And the last thing the rule seeks to do is to modify fees that are charged for access to PHI. And, there are several comments about some major cases out there about exorbitant fees being charged to patients. And a lot of those are from those third-party printing companies. And so this provision would also require covered entities to post estimated fee schedules on your websites. And then also, upon request, provide individualized estimates of fees for requests for copies of PHI. So that's really, in a nutshell, a tiny, tiny nutshell of what the proposed rule would do for HIPAA privacy. But these are some major changes. So we will be keeping our eyes out for when that final rule drops, and you will be getting more information about the final rule. And you'll see during this presentation, I have some, I guess, helpful tips on how to stay abreast of HIPAA regulatory changes, and the final rule would be one of those that you'll be able to get access to if you join certain listservs, okay? Okay, so now that we've discussed the changes that could be coming with privacy, I think that it's a good idea to kind of look at, we know HIPAA privacy rule, we know there's a HIPAA security rule. Really, the HIPAA security rule is a subset of the privacy rule. But we need to kind of understand, what are we talking about? What does privacy really cover versus what does the security rule really cover? So they work together to ensure that, that we're keeping our data protected. And the privacy rule revolves around the individual and their rights to have control over the way their sensitive data is used. The privacy rule also ensures that all forms of PHI, protected health information, are protected and remain private, including electronic forms, paper forms, and oral forms. So privacy rule does cover electronic formats of PHI. So for example, messages that are left on an answering machine, those are subject to the privacy rule, not the security rule. Also, recorded video conferences are actually subject to the privacy rule, and paper-to-paper faxes are subject to privacy but not security. Again, I know that faxes are technology, but this is considered paper-to-paper, so it's faxes are considered privacy rule. So then the security rule covers electronic protected health information. And it only covers the electronic format. So any such information that an organization creates, receives, uses, or maintains electronically is subject to this rule. So when you really break it down, its privacy covers the who has access, who may have access to our information, and applies to all forms of patients' PHI. And then security ensures that only those who should have access to ePHI has access, and does not cover anything stored on paper or provided orally. And the security rule provides for far more comprehensive security requirements, and those requirements come in the form of safeguards. So the security rule set forth three categories of safeguards that all covered entities and business associates must adhere to. Those are broken down into administrative, physical, and technical. Administrative safeguards are administrative actions that manage the security measures to protect our ePHI and to manage the conduct of the covered entity's workforce. So essentially, these are policies and procedures that lay the groundwork for how your workforce is to handle and protect your electronic protected health information, ePHI. I'll just call it ePHI for the remainder of the presentation. The physical safeguards set about safeguards for our physical access. So like to our buildings, for instance, and facility access controls. They are physical measures that protect a covered entity's electronic information systems and related equipment. So you're protecting from natural disasters, environmental hazards, and unauthorized intrusion. So examples of physical safeguards would be locks, alarms, workstation security measures would be like cable locks, computer monitor privacy filters, and then workstation use policies are also physical safeguards that would ensure proper use of and access to your workstation, so your laptops, your computers. And then the technical safeguards, again, we do cover this in all of our presentations, but this is the bulk of, this is what makes up the security rule. The technical safeguards are going to be technology controls. So they're going to be your hardware and software controls, such as encryption and antivirus protection. So this helps to kind of understand what we'll be talking about with the rest of the presentation when it comes to the HIPAA security role. But you know, if you are the HIPAA privacy security officer, you really have to be so familiar with not only the privacy rule, but the security rule. And you need to be able to understand the difference between all of these safeguards. The administrative safeguards make up the bulk of the security rule. Policies and procedures are so important. And when we conduct SRAs, that's the first thing that we ask for. We need to see your policies and procedures, and then we go from there. Let's see. Okay, so now that we understand, let's make sure that I didn't skip a slide here. Okay, yeah, so we have the safeguards. So now we're going to move into the fun part of the presentation. It's fun because it's interesting, but 2020 presented so many challenges for us with COVID, and especially with the way that we work, working from home, working remotely. And so it's no surprise that 2020 saw the largest number of breaches that have been reported to HHS. 642 breaches that were affected over 500 individuals. So okay, I can't draw on my slide. I was going to circle the bottom. So if you look at the bottom of this graph, unauthorized access and disclosure and hacking and IT incidents made up for the bulk of these breaches. Unauthorized access and disclosure can happen through a variety of ways: email, impermissible access, snooping on charts, sharing, downloading charts, and then hacking comes from ransomware, phishing, malware, and IT incidents where our servers get hacked. So our concentration on this presentation is going to be looking at protecting and finding resources and knowing more about where these breaches come from and how to protect ourselves from them. Those locations. So when we know that the impermissible disclosures and security incidents, the hacking and the hacking incidents and ransomware, where did these breaches actually come from? Where did they happen? And so this chart shows there were a lower number of laptops and electronic devices that were reported, and that's due largely to covered entities really taking encryption far more serious than they ever have before. The majority of the breach locations came from email and network servers. So, it's when we're conducting our SRAs, we ask a lot of questions surrounding the protection of your email. We ask a lot of questions about your email servers, your network servers. How old are they? Are you keeping them patched? Are you taking security updates on those? It's so important. Technology and your IT department plays a huge role in helping you meet the safeguards of the HIPAA security rule. So, from this, we can kind of summarize that the biggest threats to our security are ransomware and phishing. I'm going to go into really some more depth about ransomware and phishing and the role that played in these breaches, but that was the vast majority of the breaches that were reported last year came from ransomware, and a lot of those started as phishing attacks. Another threat to our security that it was a common theme throughout breaches from last year, and it's a common theme in all the breach reports that we read, is there's still a lack of workforce training and security reminders that go out. And this is should be a part of your HIPAA security compliance program. It's required under the HIPAA security rule. Another area that is required is tracking and reporting and responding to security incidents. And through that process of tracking those security incidents, it will help you understand and discover whether or not a breach actually took place and whether that's reportable. And what goes hand in hand with that is the failure to perform a security risk assessment. It is still common that covered entities and business associates aren't performing security risk assessments or not performing them often enough. And the biggest part of that is implementing a risk management strategy. So you take what you've learned from your risk assessment, you've identified your vulnerabilities, and now you've got to put that risk management strategy into place to mitigate and to correct those threats and those vulnerabilities. So now what we want to do is we want to take each one of these threats, we want to learn more about each one, and so that we can kind of go back and basically have resources. That's where this is all going to lead, is building that toolbox to give you resources to help you learn more about these and to help you assemble your team and make sure that you're taking the HIPAA security rule and all of its safeguards making it a high priority in your organization. So starting with ransomware, what is ransomware? We've heard this term a lot over the past few years. And so it's a type of malware, which is malicious software, and it's distinct from other types of malware by in its defining characteristic, which the ransomware infects your computer and it denies access to your data. So it encrypts your data. And it asks for a ransom. Usually it's cryptocurrency, usually is what the user is asked to pay, and usually in the form of a Bitcoin. And so that's, hackers can deploy ransomware that also destroy or exfiltrate your data. When ransomware, we've seen cases where ransomware has been deployed, locked up systems for weeks, denying access to patient data. It completely can cripple your organization. But the government highly advise that you don't pay the ransom. You rely on your backup methodologies. You restore your networks, and you seek third party if you need to assistance in doing that, because paying the ransom is basically just facilitating these hackers to continue on their quest to hack other organizations. So when we look at 2020, there were at least 560 healthcare facilities in the US that were affected by ransomware. Now, not all of those were reportable in nature. It comes down to whether an impermissible use was discovered. If the data was compromised, if it was impermissibly used, stolen, that would constitute a breach. But 560 facilities, that is a crazy amount of organizations that have been touched by ransomware. And it is the largest year of ransomware attacks that we've seen in the history of this crazy hacking world of ransomware. So the most common attackers were, I'm not going to try to pronounce these ransomware attackers, but I did put these down here, the Ryuk, and then you can see. So these were the biggest offenders in our ransomware world. And what we saw in 2020, the largest breaches that were reported were the biggest one was this Blackbaud Inc., which is a cloud service provider. It's kind of scary to think that our cloud service providers got attacked by ransomware when we rely more and more on cloud service. But the ransomware attack, more than 100 of Blackbaud's healthcare clients. So they are a business associate. They are a third-party service, and more than 10 million records were compromised. And what happened was, so prior to deploying the ransomware, the hackers stole fundraising and donor databases of its clients, which included information such as names, contact information, dates of birth, and clinical information. And from that, they were able to deploy, probably through phishing attacks, the ransomware and affected, 10 million records. So there is still, this is relatively new, even though it was reported in 2020. And as you know, it can take years to investigate and resolve. And it could be years before we even see a settlement report come from this. Mednac Services was another one. They are revenue cycle management business associate. They offer other administrative services. They suffered the largest phishing attack of the year. So hackers gained access to Office 365 environment and obtained the electronic patient protected health information of over 1,600 individuals, including social security numbers, driver's license, health insurance, financial information. And again, it will be a while before we know all of the details and what's going to come from that. Magellan Health, over 1 million records were reported breached. This also started with a phishing email, but then it ended with ransomware. So we're going to learn more about phishing in just a few minutes. The breach affected several affiliated entities, and patient information was stolen. And then Dental Care Alliance, they are a dental support organization with more than 320 affiliated practices across 20 states. Their systems were hacked, and dental records of more than 1 million patients were potentially stolen. So you may have read about these in the news. We're going to continue to follow what comes out of these investigations and look for those reports in the near future. Well, it probably won't be in the near future, but when it happens, we will definitely be sharing what the corrective action plans were for those organizations. So now that we know kind of how ransomware works, and we know that phishing can be the front end of ransomware being deployed, what technically is phishing? And it's phishing with a PH. So it is a cybercrime. It targets through emails, telephone, even text messages. I get phishing text messages, and they're so scary, real looking. I myself have come this close to responding to phishing attacks and then feel completely, stupid really afterwards because of how close I got. But they're good. They are scary good at what they do. So they pose as legitimate institutions, and they lure you to provide sensitive data. So and then they take that data and they do, catastrophic damage with it in a lot of cases. The most common subject lines for phishing emails from the first quarter of this year. I'm not going to read all of these, but you can see how, our workforce, our users can be legitimately hooked on thinking that this is a real situation coming from maybe the IT department, like Microsoft 365, scheduled server backup. And so you open the email and there's something to click, or there's something they want you to enter a password. The password enters, the emails, I'm sure you've seen them, where they're asking you to update your password. Those are some of the most common phishing attacks. So what we have to do is we have to really beef up our training, and we need to be training constantly. I read articles all the time that say there's no such thing as too much security awareness, especially in the world, in the technological world that we live in, and we're constantly under attack. So especially the healthcare world, we're susceptible. So that just kind of leads me into, that the second on my list for lack of workforce training and security awareness reminders. So let me just kind of refresh you on what the HIPAA security rule says. This came straight from the security rule. You must, as a covered entity and as a business associate, implement a training program, security awareness training program for your entire workforce. As part of that rule, it breaks down specification standards and helps you understand what a security training program would look like. So you must include security reminders. They need to be periodic. So they would include things like the latest threats, like phishing attacks. You have to include training about malicious software, so how to guard against that. Phishing campaigns is an example. You are supposed to let your workforce know that you do login monitoring. So they need to know procedures for monitoring. Your IT department would know procedures for monitoring login attempts, and you would make your workforce aware that you are monitoring those login attempts. And then password management. That's I think that most of our clients that we work with, they have the password management part of this down pretty good. It's the security reminders and the ongoing that I feel like all of us could do better with, and breach reports support that. So at a minimum, you need to provide clear and concise instructions for accessing, storing, and transmitting the EPPHI. So, you know, your workforce needs to be trained on that minimum necessary standard. They only need to be accessing information that they need to be able to do their job, to be able to see that patient, nothing more. And the password management procedures, again, I think we're good with that, but we do need to reinforce policies that prohibit leaving devices and media in unattended cars and public thoroughfares. We need to reinforce our policies that prohibit the transmission of EPHI over open networks. So don't ever access your sensitive data on a public Wi-Fi, including your email, and prohibiting the downloading of PHI on public and remote computers. Mobile devices are a part of our world. They're not going away. And there's a lot of good guidance out there provided by HHS, CMS, and I'm going to provide you with a link to a video about mobile device safeguards. But typically, as an organization, we need to expect our workforce to set strong passwords. It is strongly encouraged that you have your workforce provide some form of encryption. If they're using their phones, iPads, laptops, encryption in this at this time, especially looking at what happened in 2020, it's just a must. It's really shouldn't be optional anymore. Put the money to encrypt or invest the money in encryption techniques, and using automatic log off on those devices, requiring a unique user ID. That's pretty standard now. I don't think that we fight with that as much as we did, say, 3, 4, 5 years ago. Enabling a remote wipe. So, you know, your organization can use software that is connected to all of the workforce phones. Like at UK, we have this device installed, an app installed so that our IT department can, if we lose our phone, they could wipe the sensitive data that we access. Locking the device, everyone should use that automatic lock feature. You should make that part of your policy. If they're going to use their electronic media devices, such as phones and iPads, that they use a automatic locking device. Keep the device with you at all times. Use a screen shield. Refrain from sharing the mobile device. Register the mobile device. Install firewalls on your mobile devices. Again, your devices should be registered with your IT department, especially if you're a large organization. And then using a secure Wi-Fi connection. And then also always research all mobile applications before downloading anything on a device that you're using to do your job with and treat patients with. So this takes us into the next part of our, you know, the biggest concerns of our, you know, what we've learned and what continue to be the concerns. The third on our list was security incident tracking. And again, to refresh you with what the HIPAA security rule says, that you must implement policies and procedures to address security incidents. There's not one way that all organizations are required to do this, but you've got to have an incident response plan. So the rule says you have to identify and respond to suspected or known security incidents. You have to mitigate to the extent practicable harmful effects of those security incidents that are known to the covered entity, and then you must document the security incidents and their outcomes. So what really is a security incident? And we get asked this when we ask the question in when we conduct SRAs for clients. I understand that they don't really understand what an actual security incident is. They kind of understand that, like, when the privacy of something has been maybe compromised, maybe they've lost information or information was inadvertently given to the wrong patient. But security incidents are attempted or successful unauthorized access, a use, a disclosure, a modification, a destruction. There's a lot of adjectives here to describe these incidents of the information or the interference with system operations in an information system. So, okay, so that was a lot of words, and that's a big definition. So some examples of a security incident. So an attempt to gain unauthorized access. So for instance, we had a client to contact us about it was the CEO of the organization got an email, and it was not a phishing email. It was actually a spoofing email. This email was sent out looking like it was from the CEO of the organization to the workforce members. And in the email, it looked like the CEO was requesting information from workforce members. So wanting you to reply or click on something. There was a large investigation that went around this, and it was deemed that, impermissible access to any EPHI had not been successfully obtained. No disclosures were made. Really, they were just getting started. And so it was great that this organization caught it, reported it, investigated it, and then they documented it. And you have to keep the documentation for 6 years, because something could arise down the road that could be linked back to this incident. But it is required that all documentation, including your tracking of security incidents, is obtained for 6 years. Another example, changes to firmware, hardware, or software without consent. So if you're seeing, the IT department might come up on this quicker than just a general workforce member, but anything that looks suspicious, accidental breaches, such as emails forwarded to the wrong recipient, that is a security incident. It may be deemed that nothing happened, that the information was not further used in any sort of way. You take the steps to secure and report it, secure it, mitigate it, and it may not be reportable. But these are security incidents. But then what happens sometimes is, through your investigation, you may deem that a breach has occurred. So a breach is an incident that results in a confirmed disclosure to an unauthorized party. And when you're determining whether or not a breach has happened, HHS has provided guidance. This was part of the omnibus rule that was released in 2013, what they call a 4-factor breach risk assessment. This just walks you through it's kind of your investigation approach to deciding whether or not this security incident did reach the breach level and whether or not you need to report it. So you're looking at the nature and extent of the information that was involved. You're looking at who actually the disclosure was made to, and whether that PHI was actually acquired or viewed. And then you need to look at the extent to which it has been mitigated. And then, of course, a part of this is documentation. And then the final concern that I mentioned earlier, one of our biggest threats is the security risk assessment itself. And that is the heart and soul of the HIPAA security rule. From doing a SRA, that's where you're going to learn whether or not all of those safeguards, administrative, technical, physical, are in place, or whether or not you have gaps. You're going to learn what you need to mitigate. And so I like this quote from HIPAA Journal, because it's true. Knowing about risks to PHI and failing to address them is one of the most common HIPAA violations penalized by the Office for Civil Rights. And I can attest to that, because every breach report I've ever read released from OCR, Office of Civil Rights, is they all cite the fact that the organization had not completed an SRA, or had not completed an SRA. It had been years since they had conducted a recent review or update to an SRA, and or they had not put in place a risk management strategy to handle the vulnerabilities and to address the vulnerabilities that came about on the SRA. So in other words, don't take your SRA and just put it in a drawer and wait until next year. But you do have to conduct that SRA. So what does the HIPAA security rule say as far as our security management process? We have to have a process in place, and that security management process includes conducting a security risk assessment, implementing a risk management plan so that you put measures in place sufficient to reduce your risk and vulnerabilities to a reasonable level, Part of that security management process is including a sanction policy so that if workforce do not comply with the policies that are in place, you do have sanctions and they understand the consequences, I guess you could say, of their actions. And then part of that management process too is regular and ongoing information system activity review. So reviewing logs and records, access logs, access reports, and your security incident tracking reports. And so we always include, the actual verbiage from the risk analysis or the security rule stating that you must conduct an accurate and thorough, those are the key words, assessment of the risk to your PHI. And this also is the part of the security rule that identifies that it's not just the covered entity, so the healthcare providers, the hospitals, but it's also your business associates. So we've been telling our clients more and more because we see more and more business associate breaches, just like the ones I shared with you on the previous slide, that you need to be following up with your business associates to make sure that they are complying with their duties under the security rule as well. I just want to point out too that it's so important, even if you're a small organization, it's important that you appoint an assigned security official. You may have someone who's a privacy official, but not a security official. I've been in SRAs where I've asked and they look at me kind of silly, like, well, we have a privacy officer. Well, OCR will tell you that if you don't have a designated security official, that all of the HIPAA security rule items will fall under the responsibility of your privacy officer. And that's kind of scary for some people. I've seen it in their eyes because they're not familiar as well with the security requirements as they are the privacy requirements. So really your security responsible should be responsible. Your security official should be responsible for the development or oversight of the development of your privacy and your security policies. And you're, making sure that you have that security management process in place. So now we're going to begin to build a toolbox. I should have said this is the more fun part of the presentation. So let me correct myself. So this is the resources that are going to help us kind of know more about what we've talked about today. And actually educate our workforce more so on these items and ourselves, whether we are IT directors, whether we are the compliance officer, whether we are a key member of leadership. All of these resources are meant to help you and to be shared with other members of your workforce. The first thing I want to tell you about is that OCR has a privacy and security listserv. I strongly encourage you to sign up for the listserv. That you will get emails. They come out very frequently. And what I've done is I've captured kind of some screenshots of emails that I received from HHS, which is a department of OCR. And these are the headlines from those emails. So for instance, you might see when breaches occur, they will report those out and they'll tell you about, they're usually significant breaches, but they're always interesting to learn about and apply kind of what's happened and take it back to our team and say, okay, this is what happened. Are we good here? What do we need to check? But, so Health Insurer pays $5.1 million for a data breach. And then on June 25th, we had one, there were cybersecurity updates. So they might send out some updates in partnership with a new department called CISA. I'm going to get to that in just a few minutes, but that's where this one came from. Another one was just a cyber alert. So they send out various types of information, regulatory changes. So they sent out emails about the proposed final rule, and that would have been where you would have had a chance. You would have been notified of your chance to submit comments on the final rule, and they give you a timeline to do that in. So I highly encourage that if you're a compliance officer, your key leadership in IT, you should get on the listserv. And so I've just got a screenshot of kind of what it looks like when you go out to the listserv. The links will be provided to you, but the privacy and the security, there's one for privacy and one for security, but I can tell you that as long as you are subscribed to at least one, the emails are the same. So you will get privacy and security updates, whether you're subscribed to one or both. So some training, there's a training resource out. This is called the HIPAA Basics for Providers, Privacy, Security, and Breach Notification Rules. I like this resource. It's on the CMS website, but it is provided by HHS. They've updated this resource recently. It is a multi-page downloadable document. I think that the content in this resource is great to use for your ongoing security and awareness program. You could take some of the content out of this pieces at a time and share it as part of your ongoing training. So I encourage you, once we give you the links, to go out and look at this, download it, and put it in your toolbox for training. KnowBe4, we do have clients who have partnered with KnowBe4, which is an online training resource. You know, larger organizations, it might be more financially, I guess, feasible to do this, but the content, I can't say enough that we need more training. Typically what happens is we'll do our new hire training and we'll do some basic upfront training, and then we might do annual training. But really that's not enough, especially because we're under attack every day. So KnowBe4 is just one resource that you have for getting content, and they do have a lot of cyber content. So I would just check them out. And then this, I do really like, this is a KnowBe4 phishing, I guess, kind of a flyer that kind of helps you identify what a email that's a phishing email would look like. So this kind of gives you tips on how to break down that email, starting with who it's from, going all the way. Look at the addresses, look at the domain names, look at the attachments, like scrutinize. We've got to teach our workforce how to scrutinize every email. And it's sad, I know, as if they have the time, but this is the front end defense, line of defense for protecting our systems. Our workforce, our human resources are our frontline defenses. So there will be links in the slides that you can use. This is a free resource from KnowBe4. So I mentioned CISA earlier. CISA is a recently developed, they were founded in 2018, but we're really seeing the combined efforts come to fruition from the Cybersecurity and Infrastructure Security Agency. This agency was put in place by our Department of Homeland Security, and largely in response to the ransomware attacks that our nation is under. Now, CISA primarily is looking to protect the government networks, so all of those websites and networks that end in .gov, but through their efforts, they provide guidance for us in healthcare on how to identify ransomware, what to do in the case of ransomware. So I would also encourage especially your IT professionals I would share this listserv with them. They send out security tips. Their security tips are wonderful, and they come out frequently. Your HIPAA compliance officer, it's not a bad idea, but I will tell you that the OCR listserv, when CISA releases anything related to HIPAA or cybersecurity, OCR picks up on that and shares the CISA release. So you may see double emails relating to the same stuff. And this is just an example of what they might release, or just an example of what they have released. And this is a resource you can use. This is a paper that they released in September of last year about technical approaches to uncovering and remediating malicious activity. Great information for your IT department. They also, I'm excited about this, released a ransomware readiness assessment. Now, I have not used this. We have not tried this out at the REC, but as you can see, it was just released June 30th of this year. So there is a link and resources available for you to go out and share this with your IT department to run this tool on the network. The 4-factor breach risk assessment earlier, AHIMA has a great downloadable document for you to actually, it's it's an involved document, several pages, but if you really want to get to the bottom of whether or not your organization has experienced a breach, I would encourage you to check this tool out. And so the tools that I just shared with you, I've kind of encapsulated them all in one, making it our toolbox. This toolbox will grow and we will continue to share it with you. And Seth has placed our toolbox on our Kentucky REC website. So in the chat box, I'm going to ask him to provide the link, and you can go to the chat box, click on that link and save that in your bookmarks. And it will have links to all of these that are here on this PowerPoint presentation that we covered today. At the REC, we do security risk assessments. If you still need help with SRAs, please reach out to us. We love coming and helping the organization. If you've been doing them internally for a while, I would encourage you to reach out to us and talk to us, because having a third party come in makes a big difference. And we are able to uncover things that sometimes it's just hard to get to the bottom of. We also have our online security risk assessment. If we can't come and do it on site, we also do vulnerability scanning. We do vulnerability remediation, and we also do provide security awareness education and training. So look to us for some of these resources if you need help. We'd love to help you. And at this time, I think I'm actually right on time. I don't think that's ever happened. I ended exactly at the right time according to my clock. If you do have questions, submit those in the chat box, please. And we will reach out to you with answers to those questions. I have not been watching the chat box throughout my presentation, but I do have help in gathering anything that you've put in the chat box, and we will follow up afterwards. Thank you for joining us today. I always enjoy sharing updates with HIPAA with you, and please reach out. I wanted to tell you on those resources is the Kentucky REC listserv as well. You want to make sure that you sign up for our newsletter and our updates as well. Thank you so much. And I hope you have a great eHealth Summit experience and a great week.